Today, we're going on a journey, not through a jungle or across a desert, but inside a district laboratory. We're going to follow one single, crucial blood sample, from the moment it's taken to the moment it gives us a life-saving result. So come on, let's follow that sample and see what it really takes to get an accurate result.
It all starts with this question. It's such a tiny amount, right? But what can one single drop of blood really tell a doctor about what's going on inside our bodies? Well, the answer might surprise you. It's a staggering amount. It's like a tiny window into our health, and it can reveal secrets that mean the difference between sickness and health, or even life and death.
You know, in many parts of the world, especially in tropical countries, these hematological tests, or blood tests, are the absolute front line of medical diagnosis. For a doctor, they are one of the first and most fundamental tools they have to figure out what's wrong.
And we're not talking about some obscure, complicated tests here. Nope, these are the real workhorses of medicine, looking into things like anemia, figuring out the cause of a fever, identifying serious blood disorders, and even monitoring patients on critical medications like antiretroviral therapy for HIV.
So, where does the journey of our blood sample actually begin? You might think it's when it gets plugged into some fancy machine in the lab, but honestly, the most critical part of the whole process happens way before that. It all starts with collection and preparation.
Before a single analysis is even run, the sample has to get through what's called the pre-analytical stage. And this is all about quality assurance. Think of it like a three-part checklist. First, did the doctor even order the right test? Second, was the sample collected, stored, and transported in exactly the right way? And third, what checks happen the second it walks in the lab door? If you get any of these wrong, the whole process is at risk.
And this right here, this illustrates the first and maybe the most critical checkpoint of all. It's so simple, but so important. If the name on that tube doesn't perfectly, and I mean perfectly, match the name on the form, that's it. The sample is rejected. No ifs, ands, or buts. Because a simple mix-up could lead to an absolutely catastrophic misdiagnosis.
Okay, so our sample has passed the initial checks. Now we get to head into the lab itself. This is where the analytical stage begins, and where skilled technicians start their detective work, looking for all the little clues hidden inside the blood.
So what are they actually looking for? Well, they're counting white blood cells to hunt for signs of infection. They're checking platelet counts to see how well your blood clots, and they're looking at the size and shape of red blood cells. Each measurement is one more piece of the puzzle, helping to build a complete picture of a patient's health. But here's the thing. This high-stakes journey can be thrown off track so easily. The enemy at every single step of the way is error. Even a tiny mistake can snowball into a completely wrong result, sending a doctor down a totally wrong path. Let's look at a classic example. When they take blood from a finger prick, if you squeeze that finger just a little too hard, you can actually dilute the blood with other tissue fluids. And bam, you've just thrown off all the results. It's a simple, maybe even well-intentioned mistake, but with major consequences.
Or how about this one? That tourniquet they wrap around your arm? If it's left on too long or it's just a bit too tight, it can cause a false increase in things like hemoglobin. The sample is already compromised before it's even in the tube.
And what about once it's in the lab? You'd think it's safe, right? Well, if that blood sample isn't mixed on a special mixer for at least 2 to 5 minutes, the cells just won't be spread out evenly. And that means you're going to get inaccurate counts. See? Every single detail matters.
And get this, even the equipment can betray you. Using a pipette that's a little wet or has a tiny, almost invisible chip in it, that can mean you're not drawing up the exact amount of blood you need for the test. And again, the final numbers are going to be skewed. It's a process that demands absolute, unwavering precision.
And this is a big one. When preparing a blood film to look at under a microscope, the potential for error is just huge. A slide that's not perfectly clean, a poor quality stain, getting the timing wrong, any one of these can make the film totally useless. And that means a retest, a delay, and a patient left waiting for a crucial diagnosis.
So you're probably wondering, with all these potential pitfalls, how on earth do laboratories get it right every single time? Well, the answer, and really the hero of our story, is a super rigorous system of quality assurance and something called Standard Operating Procedures, or SOPs for short.
So what is an SOP? Think of it as the ultimate rulebook for the lab. These are detailed, written, step-by-step instructions for absolutely everything. And they're not just about how to do a test, they're about how to make sure that test is reliable, on time, and correctly reported, every single time. And a good SOP is incredibly thorough.
It covers the science behind the test, the exact specimen requirements, how to maintain the equipment, and, this is the really key part, it even lists the potential sources of error, so technicians know exactly what to watch out for.
And the difference this makes? It's literally night and day. Without SOPs, you get inconsistency, a high risk of error, and ultimately poor patient outcomes. But with SOPs, you get reliability, minimized error, and a high quality of service that gives both doctors and patients total confidence in the results. It completely transforms the entire process.
So, the next time you give a blood sample, just remember this incredible high-stakes journey it goes on. And remember this, in the laboratory, there are no small mistakes. There are only consequences. Every step, every check, and every procedure has a direct and profound impact on a person's life. Because here, precision isn't just a goal, it's the only acceptable standard.